Welcome back. Now, the third Sustainable Development Goal aims to end the HIV/AIDS epidemic by the year 2030. However, the rate of HIV infections in Uganda is still high. The Uganda Aids Commission estimates that about 54,000 people get infected with HIV every year, and the majority of these are young women. Today, Gillian Nantume brings you 3 women who are living positively. Although they give hope to those that have the disease, they advise those that are negative not to become reckless, because taking ARVs on a daily basis is not an easy task.
Nora Nabukenya, a 70-year-old woman, is a counsellor at the Art Clinic in Luanda Health Center 3 in Rakai district. She has been living positively with HIV for 32 years. Nabukenya has spent 23 years on antiretroviral drugs, or ARVs, but for the first 7 years after she tested positive in 1990 at Malago Hospital, she took Septrin to prevent opportunistic infections. When she was tested, she immediately shared the results with her husband. When her husband refused to take an HIV test, she left the marital bed and moved to another room in the same house.
Stress.
60-year-old Sulaina Kavuma has spent 20 years on ARVs. Her husband, a former soldier, is also taking the medication. When she tested for HIV, she was pregnant. She says at the time, the drugs were only found at Mengo Hospital and they were very expensive. Unfortunately, after she took the drugs, she miscarried. These women say that what saved them was joining local NGOs that had sprung up in Rakai district in the late 80s and early 90s to offer social support to those living with HIV. The NGOs later helped them to access drugs. Discordance among couples can bring tensions in the home. However, this woman, who we will call Sheila, is full of praises for her husband, who does not stigmatize her, even though he is negative. In the beginning, though, her HIV status almost broke their home.
Bangambye tetuddamu kwegatta nga toyina kondomu era ne mugamba mwami wange nti bw'oba okyetaaga abaana noonya omukazi ebbali. Omwami naye n'akituukiriza n'agenda Samoya n'afunayo bambi abaana be.
Now the discordant couple is living happily.
Njukira naawe bankeberera nali sirina mu bufumbo bwa mpeta ne tugattibwa. Nakati ndi naye era nkubiriza ne bwe mba nnyina olugendo asooka kumbuuza ekintu kimu nti wapaakinze eddagala ki. Ensonga z'amaka kati yakwata etteeka nti tulina okukozesa kondo. Era kati nze box ku box tegwawe wange.
These women offer words of hope to people who have tested positive and who are living positively with the disease. However, they also caution those who are living recklessly.
Abavubuka beekume balyoga nti waliwo eddagala. Obulwadde buluma. Gwoza oga nti munnange amize gwe ne likuwoola. Kuba eddagala lino oyagala kulya kunywa. Kati bwoga nti kabunkwate nga tolina sente zigula byakunywa byakulya otuusa okufa.
With improved access and utilization of HIV services like testing, care and treatment, by 2030, HIV will cease to be an epidemic. Gillian Nantume, NTV Tonight.